So let me ask you, do you move well, eat well, and sleep well? Do you feel that modern medicine is looking out for your best interest? Do you know how to take care of your body so you can stay pain-free and in the activities you love? Do you know what options you have? If not, that's a problem, and this podcast is the answer. I'm Trevor Folker, and welcome to the Green Bay Health Project podcast. The Green Bay Health Project podcast is sponsored by Movement, Performance, and Rehabilitation, where we help the athletes and active adults move better, perform better, stay pain-free, and in the sports and activities that they love. We do this by focusing on their movements and optimizing their mobility and strength. We believe that your body is your greatest tool, and when you take care of it, you can move better, you feel better, and you thrive. So head to movement-rehab.com, that's MVMT-rehab.com, to learn how we can help you stay active and pain-free. Hey, what's up, everyone? This is Trevor Folker with the Green Bay Health Project podcast, and this is episode number 1. I am super excited to get this out to you. I have been talking about it for months. My wife is very sick of hearing about it. It's been a process, but I couldn't be happier about it and that it's finally here. If you are tuning in, thanks for spending time with us. And if you've never spent time with me or us at Movement, Performance, and Rehabilitation, welcome. And I want you to know that our goal as a business and my goal and one of my life's deep purposes is to help as many people as possible live a pain-free, strong, and healthy life for however long they choose to do so. In this first episode, I want to talk a little bit about why I'm starting this podcast, who I'll be talking to, what we'll be talking about, who this is for, and why you would want to listen to me in the first place. So right off the bat, this podcast is for people that are trying to stay active, trying to stay healthy, whether that's keeping up with their family, keeping up with their friends, staying in the gym, dialing in their nutrition, getting some better sleep, focusing on the mental health. This is for you. I want this to be a resource for you and to talk about all things health and wellness. Now, if that's not your interest, if you're not active or if you're not interested in that type of stuff, if you don't want to take an active role in your health, then this probably isn't for you. So who am I and why should you want to listen to me in the first place? I am an athletic trainer by degree. I received my bachelor's degree in athletic training from UW Oshkosh in 2011. So I have been practicing as an athletic trainer for the last 10 years. After graduation, I went and worked in a high school for a year. It wasn't really my cup of tea. And I decided to pursue my master's degree, which I did and graduated with in 2014 from Concordia University, Wisconsin, with my master's in applied exercise science. Now, I also spent time working at Concordia from 2012 to 2017, and this is where I really started to dive into the way I treat now, and it really paved the path for my treatment philosophy. I had a colleague at Concordia who was really big into biomechanics and functional movement and manual therapy and reestablishing the body's natural movements to help heal injuries and get over chronic pain. And I became obsessed with it. Personally, I had been dealing with some shoulder pain myself for years. And, I did the meds, I did the rest, I did the injection, and nothing helped until I worked with him. And within 3 weeks, my shoulder pain was completely gone, and I have tools in my toolbox now that I know if it flares up again, which it hasn't, but I've been maintaining this stuff, but I know exactly what to do if it were to arise again, and that is all because of him. And he let me piggyback off of everything he was doing. He let me pick his brain. He let me follow along when he was working with the athletes at Concordia, and it was awesome. And then I started to put it into practice. I provided coverage for a few of the athletic teams at Concordia during my time there as an assistant athletic trainer. And it was super dope to see it work and, see it work in active people that wanted to get better and wanted to improve their performance, eliminate pain once and for all. And after my time at Concordia, I decided to move up to Green Bay. My wife is up here. She is also an athletic trainer. She has her bachelor's degree in athletic training, but naturally she had to one-up me and decided to pursue her doctorate in physical therapy, which she did, and she earned it. and she's very smart, and she's been working as a doctor of PT now for the past 3 years or so. So I moved from Milwaukee to Green Bay, and I really started to dive into the movement and mobility side of things and teaching people how to take care of themselves, and they started to take ownership in their own health. So like I said, I moved up here in 2017, and I worked in the industrial setting until March of 2020. And I had nothing but my manual therapy skills, my functional movement skills, and my understanding of proper movements and how the body is all intertwined to help these people. I would see them once a week. I would drive to different utility sites. I would work with the utility guys, electrical linemen, office admin people, and I would see them once a week, and all I had to depend on was my skill set. And I really started to hone in and get good at it. And things just started to progress. I would work with them, and I would give them home exercises. They would take ownership. They would they would view it as an investment of their health, and they would come back every week with improvements. And those improvements started to stick. And that's when the wheels started turning in my head that, wow, there really is something behind this, and I can help a lot of people. Or I have the tools and the ability to help a lot of people. So for, reasons outside of this realm, I left that job in March of 2020. We opened our own business, Movement, Performance, and Rehabilitation, in May of 2019. And in this past March, I decided to invest in us because I believe in what we're doing and jump full into our business. And so what I want to be able to do is not only share things like what you can do for back pain, shoulder pain, acute chronic injuries, and I fully anticipate my wife and I sitting down and talking about some quick tips and tricks that you can try to get some relief. But I also want to highlight specialists in the Green Bay area. Since opening our business, we've been lucky enough to meet a ton of great people, all in the healthcare realm, health and wellness atmosphere. And I want this podcast to get all those people on and have a medium for us to use and for this to be a resource to you. It's no secret that there's a bunch of problems in the healthcare field. There's a huge disconnect between healthcare providers and patients, and more people are inactive now than ever before. You always hear our parents saying they had to walk 50 miles to school, 100 miles back because there was always some obstacle that happened during their school day that just impeded their path back home. Or, working in the factories for however many hours a day, however many days in a week. And while there's exaggeration, there's absolutely truth behind it. Jobs nowadays, for the most part, are inactive. There's always going to be those blue collar workers that are out there grinding every day. But for the most part, people are inactive because jobs are inactive. And because of that, more people live a sedentary lifestyle more than probably ever. And then you throw COVID into the mix, and that just amplifies it all. The World Health Organization, I believe, defined a sedentary lifestyle as being seated for 6 or more hours in a day. So real quick, think about how often or how long you sit in a day. This includes things like driving to work, being at work, driving back to work, even sitting on the toilet. This is all being seated, and it's part of a sedentary lifestyle. They also listed a sedentary lifestyle as a carcinogen, and we all know that there's huge metabolic diseases associated with not being active. Things like cardiovascular disease, diabetes, and obesity. And people don't know where to turn to get the help, or they don't know who to trust. And I want to bring in all of these resources. So the areas of health that I'm going to be talking about, first and foremost, is movement and fitness in general. I want to bring in gym owners, strength and conditioning coaches, personal trainers to, one, grow a resource of gyms in the Green Bay area so that you can have options and you realize you have choices. But I want to talk about how you can improve your fitness and those levels. But I also want to talk about how efficiently you move. So are you squatting correctly? Are you deadlifting correctly? Do you realize how often you squat in home while picking some things up around the house? And just those natural everyday movements that you probably attribute to the gym, or you see people doing a certain exercise and you're like, I wish I could do that. But a lot of people don't realize that you're doing those things day in and day out just by doing remedial tasks around the house. And if you repetitively do them incorrectly, you're absolutely increasing your chance of injury. So how can we move more efficiently to reduce that risk? The second area I want to talk about is mental health. I have some big plans and strong feelings around mental health, and this is things like anxiety, depression, stress, and the list just goes on and on. But I want to bring in experts to talk about management techniques, and I also want to talk about my personal experience. Since I won't get into this today, but I fully intend on talking about it at some point, which is something I hope you all know I'm very uncomfortable doing, and only my wife understands the true grip that I was in and the depths that it took me to get out of it. But it was awesome once I was out of it and once I started to see these small changes. So I have some big plans. Like I said, I have some big plans on it. I want to talk about it because the one thing that helped me the most was hearing real life stories of people going through it, talking about it, and then getting out of it. And so I want to provide that to you. And the other thing is there's a huge stigma around it that it's just bullshit. And it shouldn't be. You can absolutely talk about it, and you should feel comfortable doing so. And then this is going to roll into nutrition, but the biggest thing that if you go talk to somebody, which is what everybody says to do, go talk to a therapist. Usually what they're going to turn to is medications, and SSRIs are the number one med for anxiety, depressions, increase that serotonin. And 90% of your serotonin is actually made in your gut. So dialing into your nutrition or talking to somebody that's very educated in nutrition can maybe help get you off some of those medications. I fully believe that lifestyle habits and lifestyle changes can get a lot of people off of a lot of medications that they may be taking. And so I want to bring in nutritionists. I want to bring in dietitians. Wow, can't talk. And I want to bring in functional medicine doctors. One of the best things my wife and I probably did for both of us is we see a functional medicine doctor, and they are able to dive in deeper to some things than you're probably aware of. For example, if you have thyroid issues, your TSH levels are off, and you go to a doc and they're going to give you a prescription for levothyroxine, which, if I'm not mistaken, is the number 4 most prescribed drug in the US. I would have to double check that just to make sure, but at one point it was. And they're going to tell you to monitor, to come back in 4 to 6 weeks. You're going to get another blood test. If the numbers are worse or not changing, they're going to increase your dosage, and it's just going to continue on that way. What a functional medicine doctor is great at is they can take the time, one, to get to know you a little bit more, and then they'll dive in a little deeper and find out what's actually not working or what's overworking, what's underworking, and then give the necessary, usually natural medications to combat that. And then they will check in, but there's a plan, and they do so much more than that, but that is just an example of them being able to dive in. So I really want to get a few of them on, and I love nutrition. It's super interesting. The last thing I want to talk about is sleep. It's very important. It's very overlooked. I think it's something like 1 out of 10 Americans gets the recommended 7 hours. And this is a big problem. Outside of just feeling tired, getting less than the 7 hours increases your risk of diabetes, obesity, inflammation, and cardiovascular disease. And this inflammation that I'm talking about is internal body inflammation, something called CRP, or C-reactive protein, which is a huge indicator of cardiovascular disease and oftentimes isn't covered in your normal blood work. So as you can see, nutrition, if you're eating crappy, which is something that I have gone through, you're usually not sleeping well, and there's some risk factors there. If you're not eating good, your mental health usually struggles some way. And if your mental health is bad, you might not be as inclined to be active and fit, or to get up and go out and, get back into things. So you can see that they are all intertwined. And I want to make sure that we cover every aspect of it. So if you have any experts in their field that you think would be great for this show, I would love to get in contact with them. So whether it's a warm intro or you just passing along their contact information, I'm more than happy to reach out. Just please email us at info@movement-rehab.com. That's info@mvmt-rehab.com. Our goal is to highlight all of the people we have met and more to create this type of ecosystem of health and wellness providers that have your best interests at heart and help you invest in your body. I want to help people that want to be healthy. If you have the idea that you are just getting older, or this happens with age, or you have to deal with this pain and that's just something that it's just the way life is, that's wrong. That's a terrible mindset. And you need to start to view yourself as worth it and to view your health as an investment. I mean, why wouldn't you want to be the parent or the grandparent that can still pick up the kids or the grandkids? Or, why don't you want to be able to go out and walk without having to worry about some type of pain? Or if you're in the gym, why not go into the gym and believe that you don't have to deal with that pain? You have options, and I want you to know that you have options, and I want to give you those options. I want to give you those resources. We want to help people that view their health as an investment and not a cost, because it's probably the best investment that you could make. Think about all the pointless surgeries, injections, or medications that you could probably get away from or avoid if you just changed a few things in your lifestyle. Our bodies are built to be 100 years old or older, but only as long as we take care of it. And I don't want you to strive to be normal. I want you to thrive. I want everybody to realize that you can achieve that healthy life. It just might take a little work, and it's going to look different for everybody. The road is going to be a little different for everybody, but I want to help you get there. The goal of this podcast is to help you view your health as an investment and to help you live the healthiest life you can. Hell, that's the goal of our entire business. We started our business because there's this huge disconnect between healthcare providers and patients, and there's this huge and there's this huge system that's telling people what they can get and what providers can or can't do, or what needs to be billed. And so we decided to go cash pay. With cash pay, we are able to work with people that view their health as an investment, not a cost, and we get to look out for what's best for our client, not what the insurance companies say. We treat the person and don't worry about what we're getting reimbursed for. So we had this CrossFit athlete come to us. He had been dealing with 10 years of shoulder pain, no lie, and was told by someone that the only way it was going to go away was to get surgery. So obviously, not being real keen on surgery or medication, he decided he just needed to deal with it. And he had been dealing with it for 10 years, getting by. Things were getting worse. Things were always hurting. And that's just a miserable way to live. So he was referred to us by his CrossFit coach. And, we work with everybody one-on-one for a full hour. And what this allows us to do is hear your story, hear your goals, hear what you want to get back to, hear what your pain is keeping you from. And then we get to really dive in and pick the body apart. We look at how you move as a whole. We look at how you move at each specific joint. We go through a functional movement screen, and we really work to find the cause of your pain. And once we do, we devise a plan specific to you in your individual case. No two bodies are the same and no two injuries are the same. So the fact that you go somewhere and they hand you a damn PDF document and say, do these exercises X amount of times a day, and if you don't get better, come back, and you go somewhere and you're seeing 2 to 3 times and you're not really you don't really feel like you're making the progress that you thought you should, or you're spending time outside of therapy doing these exercises and they're not really doing anything. Well, you know why? Because they're general. They're general and they're not specific to you, and that's a huge disservice. Anyways, I digress. Our shoulder patient was seen for 8 weeks, every week, once a week for 8 weeks for an hour. And sure enough, after those 8 weeks, was completely pain-free, was back in the gym, doing everything that he wanted to do. And then we moved him over to our performance package to make sure everything stays good and to fine-tune some other areas. And we see that's once a month. Going off of my little rant a few seconds ago, we had somebody else in our clinic about a week ago, and she brought her daughter in for the yearly physical, and she was also having some knee pain. So, outside of the normal physical stuff, they also looked at her knee. She ended up leaving about a half hour later with a handout on patellofemoral pain syndrome, just more information about it. No, do this, do that, no follow-up. If it gets too bad, take ibuprofen, take Tylenol. And they also received a nice bill for a few $100, and they didn't even know what it was for. They didn't know what they got billed for. Unfortunately, they probably got duped and fell into the trap of reimbursement, meaning more than what's best for the patient. So we're able to do what's best for our patients and not what the insurance companies say we should get reimbursed for. And you know what? In many cases, it doesn't match up with what you should be doing anyways. So I want you to know that you have choices, and you can also be proactive or reactive about it. If you want to stay on top of things and make sure your body is in the best shape ever or in the best shape possible to reduce the risk of injuries, get on that. See somebody once a month, work with somebody once a month, and stay on top of things. Or, if you do have an acute or a chronic injury, you have options, and there are people out there that want to help and will spend the time to make sure you do get better. I want to help you make good lifestyle habits. I want to help you live as healthy of a life as you possibly can. That is what you can expect from this podcast. Bringing in resources, bringing in experts in the field to provide you with options, all local in the Green Bay area. So I hope that I didn't go on too many rants. I have, you can tell, I have some deep feelings about some things, and the fact that patient care suffering really starts to grind the gears. So I hope you enjoy this episode. I am looking forward to bringing you this podcast, and thanks for listening. If you would like more information about one of our guests or us at Movement Performance and Rehabilitation, just send us an email at info@mvmt-rehab.com. That's info@movement-rehab.com.